You wake up and instinctively test your range of motion. A slight turn of the head causes you to freeze, your hand moving to your neck as you carefully sit up. The physical ache is difficult, but the constant exhaustion of its return is what truly limits you. The pain fades for a few days, only to reappear exactly when you start to feel normal again. This cycle forces you to live a guarded life. You stop turning your head fully to check traffic. You hold your shoulders high and tight, and moving with a constant, cautious hesitation. The real burden of chronic pain is this predictability, knowing that no matter how good you feel this morning, the return of the ache is inevitable. When the stiffness flares up, you react with the usual tools. You pull on the muscles to stretch them out, or use a massage gun to try and force the tissue to relax. You might also reach for over-the-counter pills, using medication to chemically quiet the discomfort. These methods often work for a few hours. They provide a brief window where the intensity of the pain is dialed down, but finding a few hours of quiet is different than resolving the underlying reason the pain started in the first place. Standard treatments are built to chase symptoms after they arrive. They are not designed to stop the cycle that recreates them. To break that cycle, we have to stop asking how to calm the pain today and look at why the body continues to recreate it. Traditional Chinese medicine focuses on the structural environment of the body. It views chronic neck pain as a persistent, deep-rooted pattern of dysfunction. This pattern often begins with a localized knot of tension that remains tightly bound even when you are resting. TCM identifies this unreleased tension as the anchor point that keeps the pain cycle active. Because this core tension never fully releases, the surrounding ligaments and support structures are forced to compensate. Over time, these supports bow and weaken, leaving the entire area unable to recover its natural strength. As long as that original anchor of tension exists, your body will naturally default back to the same painful pattern of movement and restriction. The 5 Essences herbal pouch was developed as a purely external way to address that deep-seated tension. It is a non-invasive approach. There are no pills to take, and nothing is ingested into your digestive system. The pouch is placed directly against the skin at the neck or the navel, where it is held in place for several days. While standard treatments offer short spikes of relief that disappear after 4 hours, this pouch provides continuous support for up to 72 hours at a time. Because chronic patterns take years to build, they are resistant to short bursts of treatment. This sustained, multi-day application provides the uninterrupted environment needed to finally influence those deeper, stubborn layers of tissue. By supporting the pattern underneath the recurrence, the goal shifts from temporary relief to a long-term change in how the neck functions. This shift is documented in Dr. Wang's 2025 case series, which examined the results of the external herbal approach on long-term sufferers. The study focused on a 52-year-old man who had been living with cervical spondylosis for 6 continuous years. After beginning the external herbal pouch therapy, his symptom severity dropped steadily. By day 14, he reached near complete relief from his chronic symptoms. The results show that even after years of chronic discomfort, addressing the underlying pattern can lead to significant, rapid improvement. If your pain keeps returning, it is likely because your current treatment path wasn't built to end the cycle. A gentle, non-invasive approach can achieve results that more aggressive, temporary treatments often miss. When you break the cycle, you regain the ability to move through your day without guarded tension or the constant fear of a flare-up. If you are ready for a different kind of support, this external approach may finally fit your life. Stopping the recurrence requires moving past short-lived fixes and choosing a method that supports the body's deeper structural patterns.